I had a patient in clinic last week, late 60s, asthma for 15 years. She was using her blue inhaler every single day, sometimes 4 times. She told me, "It's the only thing that helps me, Dr. Paul." But here is what terrified me. Nobody, not her GP, not her pharmacist, not anyone had ever explained to her that needing that blue inhaler every day wasn't a sign her asthma was controlled. It was proof it had never been controlled. That inhaler she trusted completely, it wasn't treating her asthma. It was masking a problem that was quietly destroying her airways. And the worst part, I see this exact pattern every single week. If you use a blue inhaler, there is a very high chance at least one of the mistakes in this video applies to you. I am Dr. Suman Paul. I work as an NHS and private respiratory consultant here in the UK. Before we dive in, a quick disclaimer. I'm a doctor, but I'm not your doctor. This video is for educational purposes only and is not medical advice. If you have severe symptoms, chest pain, difficulty breathing at rest, blue lips, call 999 immediately. Now, let's get into it. Here is what I'm covering today. 7 inhaler mistakes I see every week in clinic, including one that is a genuine safety issue most patients have never heard of. 2 hidden side effects your GP has almost certainly never warned you about. And I'm going to demonstrate live the correct technique for both type of inhalers, because what I'm about to show you is the difference between your medication actually working and it doing almost nothing. So the mistake number 1 is blue inhaler trap. Your blue inhaler, salbutamol, usually branded as ventolin, is a reliever. That's all it is. It opens your airways fast, usually within few minutes, but it only lasts about 4 to 6 hours. Here is what it does not do. It does not treat the inflammation inside your airways. It does not reduce the swelling. It does not prevent asthma attacks. It buys you time, nothing more. Think of it like this. Your house is on fire. Opening a window helps you breathe, but it doesn't put out the fire. The blue inhaler is that open window. Your preventer inhaler, the brown or the purple one, that's the fire extinguisher. According to NICE guidelines, the body that sets clinical standards in the UK, if you are using your blue inhaler more than 3 times a week, your asthma is not controlled. Full stop. And yet I regularly see patients who have been using it daily for years. Their last asthma review, if they even had one, never flagged it. That is the blue inhaler trap. You feel relief, so you assume you are fine, but underneath, the fire is still burning. Now that first mistake is about the wrong medication strategy. But even if you are on the right inhaler, the next 4 mistakes mean the medication might not even be reaching your lungs. And mistake number 5 is the one that genuinely scares me as a doctor. So the mistake number 2 is no spacer. If you use a standard press and breath inhaler and MDI without a spacer, studies show as little as 20% of the dose reaches your lungs. 80% wasted, hitting the back of your throat, swallowed, gone. With a spacer like this, the medication is held in this chamber. You inhale at your own pace, lung deposition improves dramatically. This matters especially if you are over 50, if you have any stiffness in your hand because of arthritis, if your coordination isn't what it used to be, maybe Parkinsonism. The spacer removes the timing problem entirely. If nobody has ever mentioned a spacer to you, ask for one. They are free on the NHS prescription. Mistake number 3 is the wrong MDI technique. Now I want to show you what wrong looks like and then what correct looks like. Watch carefully. This is what I see every day. Fast breath, immediate exhale, no breath hold, inhaler pointing off and down. Now here is correct. Shake first every time. The medication separates when it sets. Breathe out fully, empty your lungs. Press and breathe in slowly, not a sharp blast. A long, controlled breath. Hold for 10 seconds. This lets the medication settle on your airway walls. Let's do it again. Shake, breathe out fully, Slow, steady breath in with the accentuation. Hold for 10 seconds. Breathe out gently. If you are using a spacer, the same principle, but you can take 2 or 3 gentle breaths from the chamber. Both methods work. Mistake number 4 is wrong dry powder inhaler technique. Now, the dry powder inhaler, and this is where I need your full attention because the technique is the exact opposite of the MDI. The device I have here is Ellipta. Relver, Trilogy, Anoro, these are the brand names. This all use this device. It's pre-loaded. You slide the cover across until it clicks. That click means the dose is armed. Most patients who switch from a press and breath inhaler or MDI to a dry powder device like this carry over the same slow, gentle breathing technique. That is wrong. And it means the medication stays inside the device. Slow and gentle, the powder goes nowhere. Fast and hard, the full dose reaches your lungs. Here is the correct technique, step by step. Slide the cover until it clicks. Dose loaded. Breathe out fully, but away from the device. Never breathe into a dry powder inhaler. Moisture ruins the powder. Seal your lips around the mouthpiece. Fast, forceful breath in, hard and deep. Remove from your mouth. Hold your breath 10 seconds or as long as you comfortably can. Breathe out slowly. Close the cover. So for MDI, slow breath in. DPI, fast breath in. Most patients do both wrong. If you use both types, and many patients do, you need to switch technique every time you switch device. They work on fundamentally different principles. Now, everything I have shown you so far, wrong medication, spacer, MDI technique, dry powder technique, those are all fixable, straightforward once you know. But mistake number 5 is different. This is a genuine safety issue and I need every person watching this to hear it clearly. So the mistake number 5 is the capsule danger. I don't have one of those devices with me today, but this is too important to skip. Some dry powder inhaler devices like the Spiriva hand inhaler, Braltus, use individual capsules. You place a small capsule into the device, you pierce it using buttons on the side, the powder inside is then inhaled through the mouthpiece. Here is a safety issue. What I have seen more than once in my clinical practice is patients removing the capsule from the device, placing it directly in their mouth and attempting to swallow it or bite into it. The capsule is not designed to be swallowed. It is not an oral medicine. The casing is not meant to be ingested. The Ellipta I demonstrated a moment ago doesn't have this problem. The dose is preloaded. But if you use a capsule-based inhaler or someone in your family does, please hear me on this. Keep the capsule inside the device. Pierce it, inhale through the mouthpiece. That is all. If you know anyone who uses one of these devices, share this section of the video with them. It is not as uncommon a mistake as you might think, and it is entirely preventable. Mistake number 6, the 10-second breath hold. This is not optional. It is not a formality. When medication reaches your airways, it needs time to deposit on the airway walls. If you exhale immediately, you breathe the medication straight back out. 10 seconds, every dose, every time. I know that feels long when you are breathless, but those 10 seconds determine whether your medication actually works. Now, everything so far has been about the technique, getting your medication into your lungs properly. But mistake number 7, this one puts people in hospital and it has nothing to do with technique. So the mistake number 7 is stopping the preventer inhaler. The preventer inhaler, brown, purple, sometimes red, contains an inhaled corticosteroid. It reduces inflammation in your airways. It is the foundation of asthma treatment. And patients stop taking it when they feel well. I understand the logic. If I feel fine, why do I need medication? But that logic is backwards. You feel well because the preventer is working. Stop it, the protection erodes. Not immediately, that's the trap. It takes weeks. You feel fine, you think you have confirmed, you don't need it. Then something triggers an attack. I had a patient similar to the woman I mentioned at the start, who stopped phosphate in summer because she felt great. 6 weeks later, she was admitted to hospital with a severe asthma exacerbation. When I asked why she stopped, she said, "I felt so well, I thought I was better." Asthma doesn't go away. The inflammation doesn't disappear. The preventer manages it. Remove the preventer, remove the management. If you are thinking about stopping or reducing, speak to your doctor first. Do not make that decision alone. Now, those were the 7 mistakes, but I'm not done because there are 2 side effects of inhaler that in my experience patients are almost never warned about. Both are common, both are preventable, and both could be affecting you right now without you realizing it. Side effect number 1. Every time you use your preventer inhaler, a small amount of steroids deposits in your mouth and throat instead of your lungs. Over time, this creates an environment where a fungal infection, oral thrush, can develop, white patches, sore throat, sometimes a persistent cough that doesn't respond to any treatment. I have seen patients investigated for throat cancer when the actual cause was steroid deposition from an inhaler they had used for years. The fix is simple. After every single dose of your preventer with steroid, rinse your mouth with water. Swish, gargle, spit. Do not swallow. That one step every time, that's all it takes. Side effect number 2, back to the blue inhaler. Salbutamol works by stimulating something called beta-2 receptor in your airways. But those receptors also exist in your heart, in your muscles, throughout your body. Overuse causes trembling hand, a racing heartbeat, palpitation. Some patients describe an inner vibration, a jitteriness they can't explain. If you are over 50 and already on heart medication, beta blocker, for example, this interaction matters. Overuse can also lower your potassium, which affects heart rhythm. If you have been experiencing unexplained palpitation or trembling and you are using your blue inhaler frequently, these 2 things may be directly connected. The solution, proper asthma control with the right preventer. So you are not leaning on the blue inhaler to survive the day. Let me bring this together. 7 mistakes: using the blue inhaler as your main treatment, no spacer, wrong MDI technique, too fast, no breath hold, wrong dry powder technique. Remember, fast and forceful, not slow. The capsule safety warning: never swallow the capsule, not holding your breath for 10 seconds, and stopping your preventer when you feel well. 2 hidden side effects: oral thrush from not rinsing after your preventer, tremor and palpitation from blue inhaler overuse. If you do one thing from this video, stop relying on your blue inhaler as your main treatment and speak to a doctor about whether your preventer is right for you. This is exactly the type of issue I help patients resolve daily at my clinic. The reality is, most NHS asthma reviews last around 8 to 10 minutes. In 8 minutes, there is rarely time to watch you use your inhaler, discuss side effect, and review whether your treatment plan is actually working. Research suggests over 70% of patients use their inhaler incorrectly. Most have never been told. That's not a criticism of GPs. It's a gap in the system, but it doesn't have to be your gap. If this was useful, please share it with anyone you know who uses inhaler. This is exactly the kind of information that doesn't make it into a standard appointment. I am Dr. Suman Paul. Take care of your lungs. They are working harder than you think. See you in the next video.